So this is indeed an honor and a responsibility. Being a closer is a special role. Everybody has listened a lot. I've been fascinated and have learned a lot today. Your symposium, Pablo, on experience, judgment, and wisdom it's a terrific concept, and it's really been terrific, and it's reality here. So going forward, this is my experience now being a student in a new way, looking reflectively at this whole field. So I'm a fervent hipologist. This is a disclosure, definition to come. And I do have a confluence of interest with everybody in this symposium. I believe strongly in the role of mechanics in hip dysfunction, but I'm increasingly aware of the impact of factors beyond the mechanics that impact our outcomes and our delivery of care. And so that's the background in which I present my experience. We all have lots of people to acknowledge, and there's not time to acknowledge all the people who have helped me learn what I've learned. But I'll start by presenting this slide. Dietrich Tonis, Heinz Wagner, John Hall, a personal mentor of mine, and all the rest of these people, including Chad Price and Kishore. And Pablo, you, I acknowledge, in pulling this kind of an effort together. This is really terrific. What do we desire as hip surgeons? Well, again, these are my biases. These are my thoughts. Well, we all like to undertake challenging work in which we're successful. And we've heard the presentations today of very successful, very thoughtful surgeons. We want to feel good. We want others to feel good. We love acclaim, self-satisfaction, and gratefully admiring patients and colleagues. Clinical technical excellence, we got to have that. You know, we'd like to feel we're among the best, and we'd like to feel that we're getting better all the time. What is wisdom in the non-technical aspects of the profession? That will be my focus. We've heard a lot about the technical aspects. Those are really important. Well, how do you get to be regarded like an Indian tracker or Yoda or maybe a hip whisperer? Well, what does this mean in 2021 terms? To me, this means experience and excellence in gathering information. It means identifying the problems that you're being asked to solve. It means skill in analyzing data, which in turn can create the information. And then, of course, you have to execute. You have to have the technical skill. It's necessary, but not sufficient for optimal outcomes. And feedback and response as part of a learning system. And what I call connection. You know, this is a lot that wisdom is. So this is the big picture, maybe. You know, you got a shallow hip socket, you want to get it better covered. Or you got one that's too deep, you want to uncover it a little bit. In the end, you want to achieve balance. You want to achieve balance. You want to get homeostasis again. You want to restore the organism to normal. Well, what's hipology anyway, this made-up term of mine? It's a science. Indeed, it's a study of the hip. It's a study, though, also of the patient affected by hip-related disorders. It's a recognition of the complex systems within which the hip works. It's a philosophy. And the hipologist, to me, has a respect for preservation of the native hip. He or she has a respect for function, a broad biopsychosocial perspective extending beyond the hip. Because mechanical function is very important, but it's not the only concern. Well, we're here today because we're all artisans. We're craftspeople too. And hip surgery is a powerful tool with risks and benefits. It's got biological aspects and technical or mechanical aspects, unquestionably. So what are key questions about hipology? This is one of my favorite paintings at the Boston Museum of Fine Arts. And Paul Gauguin asked, where do we come from? What are we? Where are we going? And you can modify this to think of ourselves as hip surgeons and hipologists. At the AOS, often there is a flash 5 presentation in various areas. So these are my flash 5s. Number one, hipology involves much more than hip surgery. It concerns all that goes into optimizing care for these patients. It's a philosophy, it's a scientific discipline, and it's a craft. So that's point number one. Point number two is that there are discussion framers as we look at hipology broadly. There are people, there are connections among these people, and there are ideas or philosophies. Well, some of my most important people have been these. These are historical figures, they're great figures. Unfortunately, a number of them are gone. And it's one of my privileges to reintroduce some of these people to you if you don't know them already. You know, Maurice Mueller, for example, who was Professor Ganz's mentor, Sugioka, Tonis, Salter, Professor Ganz, of course, and Jeff Mast. These are some of the greats, and you should go back and read some of their original work. For me, this was my immersion course in hip surgery with Professor Ganz, Professor Wagner, where I was privileged to go first in 1979 and a number of times later to Germany, in southern Germany, where I had an AO fellowship. And this was just pivotal in my understanding, not just about the hip, but about the patient and about function. There were some great Heinz Wagner quotes. The average surgeon is an average surgeon. Not every problem has a solution. Sophisticated operations are for sophisticated patients. But he believed that sophistication can often be taught. A failure to plan is a plan to fail. And restore function and bone structure will care for itself. Hipology connections for me must include the anchor group, which has done critical prospective studies, protocols, and assessment tools. Powerful network, a wonderful group of people from whom I continue to learn on a daily basis. But this has been for adolescent and adult hip surgeons with their focus in those areas, although pediatric orthopedists have been a large part of that group. Then there's IHDI. Again, powerful worldwide networking and collaborations. And Chad and Kishore and Woody, crucial in that group. Again, connections, people, and I think that connections and collaborations are a large part of what makes hipology what it is. What have I learned in 40 years of clinical hipology? Well, I've learned that we're not usually dealing with patients who are totally well. Usually they're mechanically unwell in some way that is compromising the way their hip works. So we're trying to figure out where these unhappy hips and unhappy patients are on a spectrum in the mechanical universe, although you can view this slide of red-green zones as much more than a mechanical diagram. At any rate, we have to figure out where the people are, where we want them to go, and how to get them there. And so our interventions can be viewed as vectors, but you have to have a clear sense of what you're trying to achieve and what the problems are if you're going to have any chance at success. Indeed, this is the implication of this is that, of course, the symptoms aren't always directly correlated with mechanics. There are other important factors in our outcomes. This is a picture of Anne Mannion, who's done a lot of great work with the Bern Group and in Zurich at the Schultes Clinic in dealing with expectations and how that affects outcomes. This comes quickly to asking ourselves about the role of teams and multiple perspectives. An expert team is better than a team of experts, and any hipologist is a member of a team. This is a semi-enlightened view here. Our closely knit hip team in Boston, which includes attendings, fellows, research coordinators. But if we fast forward to our present thoughts, a la 2021, care teams are patient-centered. That's best. There are many diverse contributors to the best outcomes. But here's the most important person, the patient in the middle. And a lot of other people contribute to the best outcomes, way beyond just getting the acetabular fragment in the right place. Not that that's unimportant. A lot of what I've learned is indeed that I'm still learning and trying to improve. And this relates to my getting data, good data, converting it to information, getting good feedback, and modifying my behavior. I've learned a lot from reading. I've learned a lot from my patients. In terms of reading, Atul Gawande is a great place to go. He's written a terrific book called Better, in which he asks these questions of you, makes these suggestions to you in becoming a positive deviant, how to be better. Ask unscripted questions of your patients. Don't complain. Count things. This means analyze what you've done. Write things down and change. So how does the Hipology virus strike? What happened to me? How did it happen to me? How does it happen to others? Well, there's an appeal of renowned hip surgeons like these. There's an attraction of hip science, if you will. The hip is a fascinating organ system. I clearly was attracted by cool hip surgery, and hip preservation surgery is awesome. It's usually a combination of the above things. Well, how do you become great at this? I think you have to be a true believer and an advocate for the native hip and for the patient with a hip problem. I think you should commit yourself to never-ending learning. You must collaborate. You must believe in mentorship. So have mentors no matter what your age, and be a mentor if you can. How do we advance our field? Well, I think we must all learn individually. This includes collaborating, but not just with orthopedists. Collaborate with others who are not orthopedists. Narrative. What about hearing the patient's story and connecting? I learned a lot at a terrific course I took from Rita Charon, who teaches a great course at Columbia and heads a great department at Columbia. This is a great text, Principles and Practice of Narrative Medicine. It's enlightened me about listening, hearing, acknowledging, which is essential for connecting. Connecting encourages communication. Communication leads to better information transfer in every direction, and this has got to lead to better decisions and better outcomes. The biopsychosocial model was first talked about in the 70s by a psychiatrist who understood well that there was a lot more than just what people viewed as biology. There was also the social and psychological side of things. This may be a little bit boring and scary to an orthopedist, but this is the new reality. David Ring wrote a great editorial just a few weeks ago in the Journal of Bone and Joint Surgery. Mental and social health are inseparable from physical health. This is absolutely impossible to ignore. So my education in hipology, if you will, is that there's a value of multiple perspectives. The patient's perspective that we don't always appreciate is most important. The patient's expectations are usually not the same as the surgeon's, no matter how well we think we explain things. Major surgery, no matter what the age of the patient, no matter how well done, is a major trauma, not just physically. And most important, perhaps, patients are great educators for other patients, for orthopedic surgeons too, especially over years of follow-up. Yoichi Tsuchioka taught us that hip preservation is regenerative medicine. This is a short but brilliant article that everybody should read. And his point is that radiographic bone healing and post-op recovery of muscle strength are not the only important factors in healing. The patient has to recover in all kinds of ways, but restore function and the bone structure indeed will take care of itself. So in closing, as a closer, I'm going to bring up these points. Sources of wisdom are far beyond physics and surgical orthopedics. Einstein said it very well. Information is not knowledge. The only source of knowledge is experience, and you need experience to gain wisdom. Well, for me, my experience has been really helped by listening to my patients. My patients have been incomparable teachers for me, for their peers, and to ignore their experience is unwise. So this says, don't judge my path if you haven't walked my journey. So Megan Lance is one of my most insightful patients, and she's my own PAO patient mentor. And she has said, connect, make eye contact, sit, listen, have humility. If you don't know, say so. This will gain you respect and trust. And she suggests we remember Napoleon's words, be realistic, but give hope. Dr. Hall, a brilliant, wonderful man whom I miss daily. These are his words, and this is what the nurses wrote about him in the plaque in his old OR at Children's Hospital. The room is dedicated to compassion, respect, and excellence. Good words to live by. So I'm thanking my fellows and my colleagues for all they've taught me, as well as, of course, my patients, who are perhaps my most important collaborators. So thank you, Pablo, for the opportunity to present this work, my thoughts, my perspectives. There are a lot of references for people to read at their leisure that have also taught me almost as much as my patients themselves. Thanks again for this opportunity.